My name is Dr. Gaurang Krishna. I'm a hair transplant surgeon at Medlinks. When a hair is immediately put back in the normal tissue, your own skin and blood, the chance of shock loss, the chance of post-operative hair shedding that you all know what it is, that is also much lesser. That's why many of our patients, and we have shared those results on our YouTube channel and our Instagram channel, is that many of our patients get a reasonable result just at the third or fourth month period, which is unheard of. At most of the clinics, most of the centers, good centers, would say 6 months to 9 months to get some kind of a result, and you can do your Google search also. But here at Medlinks, patients who undergo the perfect eye technique for their hair transplant, they get a much faster result. So it's not guaranteed, of course, nothing can be guaranteed, but this is what we see in majority of a patient is much faster result. Another benefit for you is that the surgical duration is significantly reduced. Now imagine one surgery, FUE, let's say, where first the grafts are extracted, which will take, let's say, for a 3000 graft procedure, 3 to 4 hours. And after that, the slits are made, or before slits are made, then the grafts are now implanted, which takes another 2 to 3 hours. So a surgery takes minimum of 7 to 8 hour duration, start to finish. So just imagine a surgery of, let's say, 33,500 grafts, which is done through the FUE technique. About 4 hours of extraction and about 4 hours of implantation. 1 hour of slit making, that's 9 hours of working time stacked, plus the breaks that the patient takes, breaks that the doctor takes. A typical surgery lasts for 10 to 11 hours, which is a huge time. And that is the reason why many hair transplant clinics do not even attempt doing a 3000 or 3500 graft procedure in a single day. The surgery goes for 2 days. Whereas at Medlinks, we routinely finish 3500 graft surgeries in 5 to 5.5 hours. So it eliminates multiple problems. It eliminates the problem of coming back to the clinic on the second day, taking the anesthesia pain again, taking off from work again. And of course, it's a hassle. It also eliminates the risk of a overlong surgery on a single day. Why do we not want to do a 10-hour surgery in a single day? Because human fatigue factor always comes in. It comes from the patient side, it can come from the surgeon side. So once you start getting tired, once your eyes or once your hands start getting tired, the quality of course deteriorates. So we do not want our surgeries to last more than 6 hours.